For those who have suffered from debilitating mental illnesses like severe depression, the future can seem hopeless.
I couldn't get out of bed. I really couldn't do anything, and on the few occasions when I did get out of bed and go out of the house, I couldn't even make it to the post office, couldn't drive my car. It was absolutely dreadful.
Dr. Nuland, a retired surgeon at Yale-New Haven Hospital, knows exactly what it's like to be staring into the abyss. But he knows as well there is hope.
I want people to know that with appropriate treatment, it's not only possible to overcome the depression, but to get, as they say, get your life back and be, perhaps for many people, even more productive than you were before.
At Yale-New Haven Psychiatric Hospital, the staff is dedicated to making that hope a reality.
We have three main missions where we're trying to meet the challenge of mental illness. First, we're delivering cutting-edge clinical services, both in inpatient hospital and partial hospital settings. Second, we're training a generation of young psychiatrists to learn the cutting-edge techniques and to take them forward in their careers. And third, we're conducting research that we hope will change the way that we do business in psychiatry, essentially to move the field forward.
The hospital's clinical services are indeed cutting edge, and they're tailored to every single patient.
We have individual assessments, that's from the very beginning of hospitalization, which involves assessment by a psychiatrist, a licensed clinician who is a social worker, and it's a multidisciplinary approach to look at every facet of their lives and to consider these unique circumstances and factors and characteristics of each patient and meld them into a cohesive and individualized treatment plan.
And ensuring the next generation of psychiatrists maintain these high standards is key.
Teaching is central to everything that we do. We have a very active program through the Yale Medical School and through the Yale Psychiatry residency programs, and the young psychiatrists are working with multidisciplinary teams where we can teach them the new cutting-edge treatments and they can learn how to apply them to the treatment of their patients.
Perhaps the most eye-catching area of work is the groundbreaking research taking place.
The ketamine research is particularly exciting. We have found that when you give people with depression a single dose of this drug called ketamine, which acts on the glutamate system in the brain, that people who've had long-standing depression sometimes will get better very quickly, within hours. And for some people, that benefit will last for not only hours, but days or even weeks from a single dose.
And it represents an astounding study. I would say maybe even the most important finding in the field of depression over the past 50 years. Because this drug acts rapidly and it's able to produce an effect, rapid antidepressant effect in treatment-resistant patients by a mechanism that's completely different than any of the other drugs that we have available.
Some of the research can change the face of psychiatry, and at Yale, everything is in place to make that happen.
The unique programs we have here are based in a large part on the scientific discoveries of our faculty and other parts of the university. So one of the special opportunities that Yale presents is a large department of psychiatry with a lot of investigators studying a lot of different things, and they make discoveries, develop them in one setting, and then we bring them over here and implement them in the commercial realm, in the everyday realm of a psychiatric hospital. And it gives us a distinctive edge and quality to have those experts who can be consultants as well as be the people who dream up and research and prove the concepts of the programs.
We're now just beginning to develop deep understanding of the brain and how it's related to symptoms of psychiatric disease. And because these changes are happening so rapidly and so in such significant ways, it's really a time when the marriage of our academic programs, our clinical, our training, and our research all come together to help prepare us for the changes that lie ahead for the field.
Now here's a man who couldn't get out of bed, who couldn't do anything, who thought he was the worst person who had ever been born, Didn't understand why anybody even wanted to know him. Did Yale-New Haven change my life? The answer is pretty obvious.